How can we counsel patients about home isolation? So, patients will have a lot of questions, people diagnosed with COVID-19, about staying at home and keeping their family safe, keeping themselves safe, keeping their friends safe. Here are some tips about how to talk to patients about home isolation. So, first, getting to the basics. The fundamental principle of home isolation is that it's key for protecting friends and family. And so when you talk to a patient, it's helpful to let them know how COVID-19 is spread, and it's primarily through the air. So it really spreads in three ways. Somebody can get COVID when they're breathing in air, when they're close to an infected person. So the case that we're talking to about home isolation, a lot of this is about physical separation so that they're not breathing the same air as the people in their household. Um, People also can get it when, say, the person with COVID sneezes or coughs, and those droplets travel through the air to the other person, and they can catch it that way. And then somebody can also get COVID by touching their eyes, their nose, or their mouth with their hands that have the virus on them. So helping patients understand how COVID is spread can help them understand what they need to remember to isolate at home. The main things to remember is that they should try to stay 6 feet away from anyone whenever you can. So this slide is written as if you're speaking to the person with COVID. And if they can't stay 6 feet away, to wear a mask whenever possible. If possible, to use a separate bedroom and bathroom, and also to let them know to monitor their symptoms and to call their provider and seek medical care, especially if they have any shortness of breath. Specifically counsel people that they shouldn't have visitors, they should only be leaving home for medical care, and that they need to wear a mask if there's any contact, and not to share household items. So they should have their own towels, their own sheets, and their own eating utensils. You can tell by looking at this slide that it's actually easiest if a case is, if somebody with COVID is in their house by themselves, but we have to realize we are living in the real world. And so these are ways that we counsel people for home isolation. So here are some practical tips. For eating, they should try to eat in a separate space if possible. If space is shared, then to make a schedule. So maybe the person with COVID eats breakfast a little later than other household members, and then to make sure to clean all the surfaces when they are finished. For sharing items, really it's try to avoid sharing personal items, and especially sheets and towels and eating utensils. If eating utensils have to be shared, then washing them with hot water and the dishwasher in between. Cleaning really helps, cleaning all the surfaces that are touched often. So things like doorknobs, even electronics, parts of the kitchen, and then as mentioned, making sure dishes are cleaned. Um, Cleaning can be spaced out for things that the person with COVID themselves is using. So it may be that laundry could be done every few days for things like sheets and towels, especially if the person isn't doing their own laundry, and that just minimizes contact for other people in the household. And other people in the household should try to wear gloves if they have them available when cleaning or handling items that may have been exposed. Best to use a new pair of gloves each time, but again, that's likely not possible for a lot of people we work with. And so trying to dedicate that pair of gloves just to that activity and not using it for other things in the household. There will be lots of questions about pets, and other than service animals, people with COVID should really try to limit interaction with household animals. We also think it's very helpful if the case can notify their close contacts themselves. Contact tracing systems are set up to talk to the person with COVID-19 and then notify their contacts. But it's really helpful to have the case notify their contacts themselves. They can help stop the spread by letting people that they may have exposed know about it. And that counts as, and here's our timeline again, that's anyone that they were within 6 feet of for 15 minutes for 2 days before they had symptoms up until when they started isolating. So that might just be 2 days if they started isolating the minute they had symptoms, but it could be more than that if it took a few days to realize they had COVID and to start isolating. And we've really found that hearing from a family member or a friend that someone's exposed increases that trust. It might work faster than the contact tracing system, or there might not be a contact tracing system. And that really helps those contacts get tested and start their quarantine. So the other very common question, maybe the most common that people will ask you, is how do I know when I'm finished with home isolation? We're asking people to do really tough stuff and stay home and separate from their friends and family. And so it's really important to have these simple strategies on how they know when they're safe to stop isolating in hand. Make sure you know them and understand them and know kind of what the common questions will be, so we can help people get out of home isolation and go back to their normal lives. So we prefer a symptom-based strategy. I'm going to teach you the symptom and the test-based strategy, but we really prefer the symptom one. Um, and that is when these three things are true. Number one, it's been at least 10 days since symptoms started. Number two, it's been at least 24 hours since the person had a fever and they haven't taken any medicines to stop fevers. And number three, that subjectively, they've really had their symptoms improved. So a couple key points for each of these strategies. 10 days, it's 10 days since symptoms started. If they never had symptoms, then you can just count 10 days from the positive test date. And that's actually the only criteria that applies, that because the other two criteria wouldn't apply for somebody who never had symptoms. There is one exception to this, and this is people who are immunocompromised. Often they will actually need to isolate for 20 days. And that is a good time to consult their medical provider for advice on that. But the guidelines are for isolation for 20 days for people with compromised immune systems. It needs to be at least 24 hours since they've had a fever without taking fever reducing medication. Fever reducing medications are Tylenol and acetaminophen, or NSAIDs such as Aleve, aspirin, Advil, ibuprofen. And so if somebody takes these medicines in their daily life, this will happen sometime. Let's say they take Tylenol every morning because they have arthritis. That's actually okay. You don't want them to stop a medication that they take that their provider has prescribed. But otherwise, anybody who doesn't take it in their normal life before COVID really should be off of these medicines without a fever before they finish isolation. And then the last criteria is that their symptoms should be improved, all of their symptoms. If they had cough, headache, and fatigue, then all three of those should all be better. That's a subjective measure. If their symptoms aren't better, this is why we say isolation lasts at least 10 days. Sometimes it might take longer, and then we would just have to continue checking in with them until their symptoms are all better. The exception here is loss of smell and taste. That's caused by nerve damage. It can take a while to come back. So if all of their other symptoms are better, except for smell and taste, then it's okay to clear them from isolation. And so that was the symptom-based strategy. That's the most common one, and it really is the best one. And that's because for a few reasons. One's really practical. People can stay positive on their test after they're not contagious anymore. If there's dead virus, it can show up on PCR tests. So it's actually beneficial to use the symptom-based strategy and not the test-based strategy, because those tests can stay positive for a while. The other is as you'll see with the test-based strategy, people need pretty reliable access to testing with fast turnaround times. And so it's probably easier to use the symptom-based strategy, less travel to test sites, and less of that waiting and potentially less financial cost. But for a test-based strategy, for people who want to use it, there's 4 things that must be true. A positive test has to be at least 24 hours before the negative tests, and then we need 2 negative PCR tests more than 24 hours apart, each of those. And the symptom strategy kind of sneaks in here, because they also need to have that 24 hours without fever, and any respiratory symptoms like cough or shortness of breath need to be better. So here's kind of a timeline of what that test-based strategy would look like. So there's a positive test. That's why they're a case. They're in isolation with COVID. They have to wait at least 24 hours before getting their next test. That has to be PCR and it's negative. Another 24 hours has to go by with a second negative PCR test. And it has to have been 24 hours without fever, with any cough or shortness of breath improved. So that's the test-based strategy to clear isolation. And those are some quick tips and tricks to support people who are in home isolation.